It is the School-Based Health Center Coordinators meeting. This year we started inviting mental health partners to join the coordinators meeting because we do have some mental health updates frequently and really working on that integration of bringing mental health into the primary care setting. So just a reminder to everyone who's on the call today and to the presenters who are presenting to keep that in mind also. So I'm going to turn it over to Jessica Duke, who's the manager for the School Adolescent and School Health Unit, and she's going to give some updates on staffing and budget.
Hi, everybody. So I'm here just to give a really brief update on staffing and budgets. And with our budget for school-based health centers, we are really fine through this biennium, which goes through June of 2021. Several of you probably know it is currently the legislative session is underway, and there's a lot going on with adolescent and school health broadly, but there are no anticipated changes to the school-based health center budget. So for this biennium, we are looking really good, and hopefully that will continue. We have a few staffing updates. In adolescent and school health, we are welcoming Liz Stewart, who just joined us a few weeks ago as our policy and assessment specialist. She's actually serving in that role as a temp. She has had a lot of experience within the Oregon Health Authority and is really great at helping us shepherd, particularly through the legislative session. We will be opening that position up as a limited duration position probably in the early spring. Wes Rivers, who many of you may know, he is currently on a job rotation. So we're sort of backfilling while Wes is on that job rotation. And we are currently in the process of interviewing for the school mental health specialist position, which was Kate O'Donnell's position. And if those of you who are at the in-person coordinators meeting in October were able to wish Kate well in her new job. She's right next door in maternal and child health. And then always exciting, we have a new baby on board. So Tara Miller, our systems development specialist, you may also remember her from the coordinators meeting. That was actually her last official day before going on leave. She welcomed Francis on October 19th. And so the picture with Tara in it, Francis was 19 days old. And then the other picture with that big smile is a more recent picture. So we're super excited that we have another little one on the team. And now we're going to move right on and dive into data.
Hi, everyone. This is Sarah Nipper, and I am going to talk to you today about the 2019 Oregon Healthy Teen Survey, a little bit about the survey, and then talk about kind of what's coming up next. So the OHT survey, which is a survey of 8th and 11th graders on a variety of health and mental health and school climate topics. It was administered in the spring of 2019, and the results came out this past fall. So we had about 28,000 students participate, and that was across 227 schools and 77 districts. The sampling and weighting is done in a way so that it can be, reports come out which are representative of the state, across the state for these ages, as well as county reports. And historically, this survey has been conducted in the spring of odd years. However, this was the last year of the Oregon Healthy Teen Survey in 2019 because coming soon will be the Oregon Student Health Survey. And I just wanted to give you all just a quick little update here on what we're doing. So we have had the OHT survey. There has also been a student wellness survey, which has been conducted in schools on even years, and that one was really focused on substance use, mental health, and school climate. There was a lot of overlap between the two surveys, but we are coming back together and doing one survey. So beginning this fall, we will be the Student Health Survey, and this survey is going to be 6th, 8th, and 11th graders, and we've been doing a lot of work to make it an improved survey that hopefully meets the needs of more stakeholders as well as youth. And so just a quick overview of some of the improvements that we've made going into 2020. We've added questions to the survey and beefed up the sections on youth assets, suicide, social media. We've spent some time refining our ACEs and trauma questions. We've made the survey shorter and cut down some of the substance use questions, but we definitely heard feedback that it was too long. We created and are continuing to create data tools in order for districts to have timely and easy access to the data, including for the 2020 survey, there will be a really cool website where districts will be able to go in and run their own reports for certain subpopulations. And so, you'll be able to contact your district if they're willing to share the username and password information. You will also be able to see data on the kids in your district if your school or district serves 6th, 8th, or 11th grade. We also have made an effort to improve the quality of the scripts for teachers who are administering the survey, as well as providing more feedback on resource sheets so that kids who are answering questions know they have resources available to them, which certainly includes you all. And then we've moved the survey administration to the fall. So instead of doing it in the spring when there's a lot of testing, the survey will now happen in the fall. And then we have a new contractor, which is really just designed to support schools better and, again, get us to some better data reporting tools. So for now, I'm going to share several slides about the 2019 results. A lot of this is available in a report online, but it's a big report and it's a PDF, and I thought it would be helpful to just highlight for folks some of the trends in adolescent health indicators. So first of all, just looking at who participated, these are all the counties and then the districts that participated, and all the highlighted ones are where our districts where we have school-based health centers. We had participation in nearly every county except for Wallowa and one other county. Anyway, 2 counties did not participate, but we had pretty good participation across the board. So we do have county reports for all the counties that did participate. So just here's the demographics of who participated this year, just to give you an idea of who is in there. So about 30% of the participants were Hispanic and about 60% were white. And you can see the other race and ethnicity breakdowns. And then sexual orientation, we have between 10 and, 15% of our students who identify as either bisexual, lesbian, or gay in our survey. And so you can kind of see the breakdowns there. And then also gender identity. So we have been refining the way that we ask our youth about their sex at birth as well as their gender identity. And so you can see, and some of these will add up to more than 100 because of folks allowed to kind of select multiple things here. But so now we're going to look at some of these indicators. So first, some access to care information. So when we look at, we always ask our youth about whether they've had a well visit or a checkup in the past year. On a lot of these slides, I've put some little arrows just to give us a sense of whether this is trending in a positive direction or not. And these are not designed to be statistically significant. It's just to kind of give you a quick way to assess. So, this is a positive thing. I think overall we can see over the past several years that we have increasing rates of our youth reporting that they have had well visits in the past year, which, I know that you all have also been improving your well visit rates, and I know it's been a priority at the state level. So I think we can see that a lot of that hard work has been paying off. We also asked them about whether they've had an unmet need in the past year, unmet physical health need, and this went down quite a bit in 2019, and I'm not sure if we know exactly what's going on, but this is definitely a positive sign. And then we ask youth whether they have access to a school-based health center at their school, and then if they say they do, whether or not they've used the SBHC. And so I think it's just always interesting to see, you know, who's saying they have access. And so this is pretty flat, but we see a little bit less than half of the 11th graders and about a third of 8th graders saying that their school does have a school-based health center. And then of those who have one, you know, between 30 and 37% have used it in the past 12 months. And again, this is pretty flat, pretty consistent trends across the last 3 years. So social determinants of health, I have a couple of slides here that we want to take a peek at. One is food insecurity, and this one we've asked for several years. And this is also going down a little bit, which is great. And so this is a 12-month measure of whether they've had food insecurity in their household. And then this year we asked a new question on housing stability. So we asked them whether they'd ever experienced unstable housing, and then whether they'd ever been kicked out, abandoned, or run away from home, and so had to sleep somewhere other than their parents' house. And, you know, to be honest, these rates are very low, and we think this is probably an undercount, especially given the information we have about Department of Education survey of sort of housing stability. The rates are much higher. So we're kind of looking at whether we may need to tweak some of the wording on this question, because we know that rates of housing instability are higher than 2% or 3% across the state, but it's interesting to see nonetheless. So now I'm going to show us some results on school climate and violence issues. Chronic absenteeism, so this is missing at least 10% of school days in the past year, and this is up sort of a little tiny bit, mildly. So, you know, it's 11% in the 8th grade and 18% in the 11th grade, which is, you know, certainly higher than we'd like to see. We also ask youth whether there is a teacher or other adult at school who cares about them. And this is part of our positive youth development benchmark, which I will get to in a little bit. This is also an area in which on the new student health survey, we are increasing questions around kids feeling supported by adults, both at school and outside of school. But anyways, this indicator is has been going up a little tiny bit in the 11th grade on the last few years. So, I mean, that's good. I think we'd like to see this at 100%, but, you know, at least we're going in the right direction. And then we have a couple indicators on school climate. So kids that have said they've been bullied at school in the past 30 days. This is, you know, with the exception of 2013, since then it's been pretty stable, hanging in there around 30% for 8th grade and 20% for 11th grade. And then we asked kids whether they've had to miss school in the past 30 days due to safety reasons. And this one is actually going up a little bit, especially in the 11th grade. So it's interesting to look at those next to the bullying. They seem actually to be capturing pretty different things. And then this is just for our 11th grade. We look at sexual violence. And so we have a couple different indicators here. We have the first bar, which is whether they have ever experienced sexual assault, whether they've experienced physical dating violence. And then the last one is whether they've ever been pressured to have sex. And so the first two are very consistent from year to year. It's this third one that is up a little bit this year, up to 14% of 11th graders who report having been pressured to have sex. And while I don't have it here, I know that if we looked at this by gender, there's a a huge disparity, and I think it's close. I want to say it's around 21% if you look at just kids who identify as female. So, yeah. Okay, I'm going to show you some indicators on resilience and emotional health. I'm glad we have some mental health folks on the phone for this. So just as we ask youth about their unmet physical health needs, we also ask them about their unmet mental health needs. And if you remember, the physical health needs, unmet needs was trending down, but perhaps not a surprise to folks on the phone. The unmet mental health need is really has really been worsening, a steady trend in the wrong direction since 2013. So between a fourth and a fifth of our youth are reporting an unmet mental health need in the past year. Suicide, kids reporting whether they've contemplated suicide in the past year is also headed up a little bit. And I know that aside from our OHT data, I know that there's been some data reported out of our vital statistics about suicide, completed suicides going up as well for youth and young adults. And then I do have a couple slides here that break some of these indicators down, and this is not something you'll find in the report, but this is 11th graders who reported contemplating suicide in the past 12 months by race and ethnicity. And if you look, you can really see that, you know, the burden of suicide contemplation is really unevenly distributed here. So Native American youth, you know, more than a quarter of them say that they've contemplated suicide, which is pretty striking. You know, kids who selected multiple race also have a higher rate of suicide contemplation. And then this is the first year that we separated out Middle Eastern or North African as a separate category that youth could select, and they have a much lower rate of suicide contemplation, as well as some other risk behaviors in the data. We had a new question this year on access, how quickly you could access a loaded gun. And there are certainly lots of legitimate reasons why this would be a thing that kids have access to, but in the context of our rising suicide rate, and we just felt like it was important information to have. And so this is 11th graders, and I just did a county map just to give you a sense of, this is youth who said they could be ready to fire a loaded gun in less than 24 hours. And you can see that the rates, you know, perhaps not surprisingly, are higher in Eastern Oregon and a little bit in Southern Oregon, some of our more rural areas, but they're, you know, pretty mixed in there, even in the metro area and kind of central Oregon. And so this is, I know this is a really sensitive subject, and it's one that we want to approach with a lot of wisdom and care, but also something that we think is pretty important just from a safety and prevention standpoint. So we have our positive youth development benchmark, and this is a composite of 6 different measures that we've been tracking for several years, including unmet needs and caring adult and kids saying that they feel competent and confident. And this really has been going down quite a bit. So we're down to under 60% now for both 8th and 11th graders. And when we look at what's driving it, mainly it really is unmet mental health needs, because that's going up so much. It's really driving down our benchmark. And so I've just broken down the benchmark here by some other demographic categories. So this is by gender identity, and there's a pretty big disparity here among girls and boys, and then those identifying as transgender, gender diverse, and other. Certainly, our our transgender and gender diverse populations are really struggling here with some of these areas, and I know that the unmet mental health needs for this population are pretty high. But even just the difference between males and females, it's pretty striking to see. And then the last breakdown here for the benchmark, oh, just kidding, second to last breakdown for the benchmark, sexual orientation. Again, we see that kids identifying as lesbian or gay or bisexual, basically anything other than heterosexual, have much lower rates of PYD benchmark. And again, in large part, this has a lot to do with having greater unmet mental health needs, and as well as some of the other indicators like having a caring adult at school that they can talk to. And then the last breakdown for the benchmark, again, is by race and ethnicity, and sort of the inverse here of what we saw with suicide contemplation. So, we see that our Native American youth have the lowest benchmark rate, and our Middle Eastern, North African youth have the highest reported rate. Everyone else kind of in the middle here. So there's a lot of disparities going on in our youth population as far as, feeling competent and confident and able to kind of take on life's problems. And then the last area I want to highlight is substance use. So our 30-day marijuana use rate, I know there's a lot of energy around this. And so when we actually look at the data, we see that our 30-day rates of marijuana use are actually pretty flat. I think it's just remained really steady. So we're looking at 20% of 11th graders, 8% of 8th graders have used marijuana in the past 30 days. And I think sometimes there's this idea that this rate is just going up and up and up, and that's just not reflected in the data. So now we're looking at 30-day smoking and vaping. And so there's kind of a lot going on here. But the first set of bars here is 8th graders who've reported using e-cigarettes or vaping in the last 30 days. So you can see in 2013 that was 2%, and in 2019 that's 12%. And so that is a pretty significant jump over time for sure. The second one is the same thing, but for 11th graders. So in 11th grade, in 2013, they reported 5% of them reported having used e-cigarettes or having vaped in the past 30 days, and that is up to 23% now. And so, that's definitely a big jump. But then if we look at cigarette use for 8th and 11th grade, that is down and actually very, very low now. So among 8th grade, it's 3%, and among 11th grade, it's 5%. So I think we're seeing sort of methods here being switched around as we see some of these rates kind of go up and down over time. But I think it's pretty notable to see among the 11th grade in particular, the vaping increase. And then for the first time this year, we asked kids specifically about whether they had used a delivery device similar to a USB flash drive like Juul. And so this is 30-day use of Juul or a similar product. And this is 8% for the 8th grade and 18% among 11th graders. And we'll continue to track this one over time. And then the last data point here I have for you is binge drinking. And binge drinking continues, especially, it's very low among 8th graders, and in our 11th grade, it continues to kind of slowly and steadily decline each year. And so that is really good news. And we're seeing kids making really better choices among alcohol use. So what is next here, and if you wanted to get more information? So all of the county reports where you can find data for your county are available online. It's a very, very long URL, so I created this small one for you that would be easier to type into your browser. And you can look through your county and kind of see how you compare to the state. especially if you were in a district that participated. Like I said, there is a new interactive data tool being developed, and I see that I did not finish my second bullet point here. Districts will be able to, the sky's the limit. Anyway, districts will be able to create their own reports, like I said, with crosstabs, and they can share that information with whoever. So hopefully you'll be able to go in and be able to see, for example, among students that said they've used their SBHC in the past year, you know, what do they look like compared to students that haven't? Or, you know, if you wanted to look at gender breakdowns or whatever. Recruitment for the fall 2020 Student Health Survey is going to be happening this spring. Every public school in the state, this is also a new thing, is going to be invited to participate. Anyone that has 6th, 8th, and or 11th grades will be invited to participate. And I know it's going to be a big push to hopefully get as many schools to participate as we can. And so, you know, I think your support in that, that this is really valuable data. We're also trying to increase our efforts to partner with districts and to just support them in using their data. And we know that you know, you all are an important part of that too, as a resource for the students in your school. So that is all I have. I know that was a lot of data. And, you know, if you have questions, I'm happy to answer them, or if you want to email me, I'm happy to chat more about this.
All right, so this is Loretta. I'm just going to share with you all 3 quick slides about some encounter data and actually some operational profile data. And I wanted to mention that this data is going to be in our status update that we are working on now, and our goal is to have it finished and posted on our website around the end of this month. Do you have a specific date?
This is Roslyn. So we're shooting for to have it on our website by the end of February. One big change with the status update this year is that we are not doing a hard copy print. Gonna let people digest that. So you will not be receiving them in the mail for your school-based health center. We're not sending them to schools, county health departments. Again, we're not doing a print this year. It's an update. It will be on our website. It's a shortened version. I think if people are needing printed copies and you're having a hard time getting those, you can contact our office and maybe we can help support the sites to print some. But we're not doing a massive print this year.
Okay, so this hopefully will encourage you to check out our status update when it's posted. So this is just a great graph that shows the increase in the number of clients and visits going back to the 2013-14 service year. So you can see obviously a steady increase. A good portion of that is attributed not only to the increase in the number of sites, but also to mental health services and additional mental health funding. And here's just specifically the behavioral health visits. And just to clarify for this, when we say behavioral health, for us, this includes mental health and substance abuse counseling. So if you look here, you can see that there's been more than a 500% increase in the number of mental health visits, behavioral health, going back to 2012-13 service year. This also will be in our status updates, and we will be sending out the PowerPoint presentation, so if you're really into any of the data, you will certainly have access to all of that on here. And then this is from the operational profile. This last October was the first year we added on really detailed questions about contraceptive services that are being offered in your school-based health center. And as you can see, I'm not going to read through all the bullets, but the first one is that 62% of sites were dispensing at least one type of contraception on site. And you can see there the percentage that are providing LARCs, And then this little table is a nice breakdown, gives you lots of information. We've gotten a lot of questions from folks asking about contraceptive services. And so the fact that you all are now providing this information to us in the operational profile is really helpful. We don't have to send out surveys, trying to make data collection a little bit more efficient. So again, this information will be available to you all when we send out the PowerPoint. I'm going to go on. Does anybody have any questions?
And if you have any questions, you can type them into the chat box. There was a question asking me to clarify what I'm talking about for the printed copies, and thank you for the question. So historically, every year, our office, the School-Based Health Center State Program, produces a status report, and that's during the odd years. And during the even years, we do a status update to that report. It talks about the data that we've collected from you all in the last year. We talk about some of the programming and policy policy changes or updates that have happened with the program. We might link it to some of the health systems initiatives that are happening across the state. And we've always sent those out to all of our partners. That includes our school-based health centers, our medical sponsors, our county health departments, our schools, our school districts, and our other community partners. And so, again, you won't be receiving that this year. We'll send an electronic version with some information about it, so you can still share it electronically, and you'll know when it's up and available. But again, that won't be printed for you. And then we have some other questions.
So we had a question of those SBHCs that provided contraceptive services, how many health centers serve students only and not community members? We don't have that data right here available to us, but that is certainly something that we can calculate out. This is a great question. Let's see. Future data analysis and reports separate behavioral health appointments that are primary care led from mental health visits.
So I think, this is Rosalind. So as many of you are aware, there are school-based health centers that have a model where there's a behavioral health provider that is coming mostly from the primary care side versus the mental health side. And we're actually seeing this model expand. So you might have a therapist that's providing mental health therapy or long-term counseling, but some of that brief interventions might happen with the behavioral health provider. And so we are, and Kavita on our team has been working at diving into that data. Some of it is figuring out actually like the data integrity of the data coming in, and if what we're seeing actually aligns with what we're hearing is happening in the field. I think we definitely are interested in sharing more of that data. I think Kavita actually has a poster accepted on the top. Is that?
Yeah. So a poster of the National Alliance, and then for the 2018-19 data, if the sites remember, I had sent out an email to the sites that do have behaviorists to get some data in about the different billing codes used by behaviorists for these services, and I'm in the middle of getting that data together and sending it back to the sites that reported on that. So you should soon.
Yes, but we are very interested in looking at the data associated with that model and aligning it with what we think or know is happening in the field. Other questions?
No?
Great. So I'm going to transition over to Adrienne Mullick, who's from the Transformation Center, and she's going to talk about some of the related CCO metrics that you all might be interested in working within the adolescent health population.
Thanks. Yeah, so hello, thank you for giving me the opportunity to spend a little time. I have 2 minutes on the agenda. Can I take a little bit more than 2? 10. Oh, I know, but we're just looking at
it. Yeah. No, you're good. You're good.
Wondering, should I'll meet you somewhere in the middle.
I just did this.
Oh, perfect. Okay, great. So I just wanted to, I'm from Philly and I can talk fast. I just didn't know how fast I needed to talk. So I'll organize
10 minutes.
it a bit. Okay. Anyway, this is a little bit of a PSA for the work that we do at the Transformation Center, and as it relates specifically to the alignment of how we might be able to work together to help the CCOs in the service area where you might be located, how potential partnerships to work together to help meet some of the incentive metrics. I am specifically currently working on the well child visit, and I had met with some of the lovely school-based health center team here at the end of last year, and we thought maybe this would be a great place to start the conversation. And so ultimately, after I talked to you quickly here this afternoon, my contact information is at the end. And so if you're interested in talking more about some of the questions that I'll pose in today's slides, please feel free to follow up with me and we can take it from there. So just a little bit of information about the Transformation Center. Ultimately, we're known as the hub for innovation and quality improvement for Oregon's health system transformations efforts to meet that triple aim, which is better health, better care, and lower costs for all. We can just go to the next slide. The Transformation Center provides a lot of technical, targeted technical assistance to CCOs across the state, and we do that in various topic areas, which are all listed here on this slide. The CCO incentive measure, as you can see, is just 1/8 of that topical support that we provide. And I think I have a little animation here just because I also work to support the community advisory councils across the state. So if you're interested in talking to me about those, I'm always interested in trying to find ways to support the CACs and the work that they do. The community advisory councils ultimately have Oregon Health Plan members as a majority on those councils, and that the council is informing the CCOs in how to best serve the community. So diving a little bit more deeply into the conversation of metrics, CCO, well, Oregon Health Authority basically uses quality health metrics to show how well CCOs are improving care, making quality care accessible, eliminating health disparities in a number of different ways. They have these ways of measuring that. And these fall into two buckets, really: CCO incentive measures, which, as you likely know, are basically the CCOs are then eligible to receive payments based on their performance each year. Then you also may have heard about state quality measures. Those are different than what I'm interested in talking to you more about today. I'm really interested in about the incentive measures. And then just to reiterate, the Transformation Center's role is really to provide that targeted technical assistance to CCOs, clinics, and other interested health system partners, such as yourselves, who may be interested and involved in this work. Sometimes there's confusion about the Transformation Center's role versus the health analytics role. And ultimately, health analytics, which is also within OHA, really gets down to the data. And they're drilling through the data to not only inform OHA, but also to provide the information to CCOs so that they can see how they're doing in these various areas. So just so that you know, for 2020, there have been 13 incentive measures that have been decided upon. And the Metrics and Scoring Committee, they're the ones who kind of select that measure set, and they determine the benchmarks that for each of the different incentive measures. I have handouts that I can provide you. If people want more information, you could maybe use it as an attachment if you do a follow-up email or something. And basically, the benchmarks are where they, if they meet the benchmark or their improvement targets, then they get the money that they're being incentivized to try to meet. And amongst the 13 incentive measures that are established for 2020, every year there are some challenge pool measures, which is like bonus funds if you meet these ones in particular. And so the well child visit, which I'm in the process of providing technical assistance to CCOs, and that's in multiple methods, the challenge pool is one of those. So ultimately, if your school-based health center is providing well child visits, and one of these lovely ladies provided me with the data that shows just how many are happening across the state, and there's some that are significantly meeting this 3 to 6 year old age bracket. So if you're interested in potentially working with me to kind of figure out how you can work with your CCO, there is the challenge pool. It's really incentivized to do. Did you want to?
Yeah. This is Rosalind. I just want to clarify, and I know we've talked about this at our coordinators meeting in the fall, is that the well child visits metric has changed in the sense of that it is no longer an adolescent well child visit. So it's not a typo that it's a 3 to 6
Yeah.
age. The shift, they have removed the adolescent well visit as an incentive metric, and they're focusing on the 3 to 6-year-olds. So I just want to clarify
Yeah,
for
thank
people
you.
who may not.
Yeah,
have heard
and
that.
we had worked in the past in providing targeted technical assistance for the adolescent well visit.
Yep.
And so, but yes, that has shifted in 2020. So now we're focusing on the 3 to 6-year-olds. So on the next slide, you can see, and again, I'll provide a handout that shows all 13 incentive measures, but the information on the screen right now, which includes hyperlinks, I don't know if you get the PowerPoint slides, but ultimately, the hyperlinks take you to the individual page where we talk about the different types of technical assistance that's available for each to support each of these measures. And you'll see that of the 13, 1, 2, 3, 4, 5, 6, 7, 8, 9, we're currently providing targeted technical assistance for 9 of the 13 measures. So on the next slide, at the recommendation of Rosalind or Sarah or all of the above, I was asked to kind of say which ones are specifically likely of interest to the school-based health centers. And so the related measures of the subset of the ones that the technical assistance packages come out of the transformation center, these are the ones that I imagine would be of interest or related to the work that you're all doing. Yeah. So in the spirit of being able to talk fast, I did pretty well. And so now I'm at the place where I, would love to pose some questions to you all. And if you want to type in answers or you want to type in questions, we have a couple minutes to field those. But, the questions that I would love to be in dialogue with you all, whether it's now or at a later date, are, relating to, how is your school-based center collaborating with your local CCO? And I could go in general, or we could go specifically to the well child visit for 3 to 6-year-olds. So I would love to hear from anyone on the call today. If you want to type in the chat and tell us a little bit about how you might be collaborating with your local CCO to support this measure or any measures. Also interested in hearing from you about the type of support that you could benefit from having from your CCO. I'm in a position where I could probably liaise some of that, those connections, and would be most interested in doing so. And then finally is just who's interested in continuing this conversation. So if anyone out there is intrigued and wanting to talk more about this than we have in the remaining 2 minutes, please reveal yourself so that we may be in touch. And you don't have to call yourself out via the chat box, because on the next slide you'll see my contact information, so you can reach out to me offline if you want.
We do have one question. What is the expectation for the 3 to 6-year-old well child checks? 1 per year or 1 within that age group?
Yep. So the measure description is it's 1 per year. So the percentage of children ages 3 to 6 that have had 1 or more well child visit with a PCP during the measurement year. And the PCP can be MD, it can be ND, it can be DO, and it can be some NPs. So I think that is relevant to providers that are out there at the school-based health centers across the state.
This is Rosalind. I just want to really encourage you, if you have, this is all very new to you and you want to learn more about what the transformation can do to help support either the school-based health center or your larger system, I think reaching out to Adrienne would be great. She's very approachable, and definitely there's no wrong question. And so we have this fabulous relationship with the Transformation Center, and having Adrienne here today is to make her more accessible to the field and for you all to recognize that. So please reach out to her if you have questions.
That was the data we read for Adrienne.
Yeah, see, I still have it. Your time was well spent. Thank you so much. Oh yeah, so then on the next slide, you'll just see another question.
Yeah. Some states are tracking ACEs and correlating them to the cost of specific health disparities. Is there any interest in doing this in Oregon? I've participated in surveys for CCO work groups, but I'm struggling to attend the meetings due to my required work. I'm very interested.
Yeah, I don't know a lot specific about ACEs and how that's all. Somebody's raising a hand in the room. We have wisdom within the room.
There is a site available currently, the OPIP site tracks child health complexity, which is about as close as I know to tracking ACEs. So it looks at social as well as medical need. So it's not directly aligned with all, when we're talking about ACEs, I know there's specific research on that, but that's about as close as I know. That's a resource we can send out if people are interested afterwards.
Yeah, and if you want to follow up with me specifically about the ACEs, I can poke around at the various places where I know there might be more information, and we can.
And those reports are released at both CCO level and district level.
The health
Or county, county level.
County, yeah.
County, sorry, yeah, the health complexity.
Yeah, and there's the data actually had to be retracted, so that's not necessarily the best source of information.
So there's one measure, but it's not.
Right. So if you wanted to talk more about ACEs, whoever that is that posed that question, you can link it to me, and I can follow up. Yeah.
Great. Thank you.
Thank you so much.
Thanks, Adrienne.
Okay, we're gonna shift some gears a little bit and talk a little bit about some of the work that's happening in the Adolescent and School Health Unit. I'm going to start from the School-Based Health Care Program, and then we have Corinna here from the school nursing side, and then Sheila from the Youth Sexual Health. So I will lead us off with the School-Based Health Center State Program Office Strategic Planning. So we, as a full team at the time, met in September 2019 to talk about our goals for the next 2 to 4 years. I think it's important that I want to reflect that we were a full team at that time, because we do have particular team members that have very specialized topic areas, like the mental health specialists, and I want to just make sure people are aware that the nurses, mental health, research, everyone was reflected in these discussions. So what we typically do is we have kind of a brainstorming activity, and we talk about what's working, what can we improve on, what are the important policies or practices that we need to address, and I left it open also. And then we talk about how to support and advance the school-based health center field. So we look at what's happening in the adolescent health world, and then what's happening in our school-based health centers. And then we identify some priorities, and then we just keep on with the brainstorming. I also have this note where I want you all to know, people have worked with us in the past, but for those who haven't, around these bigger programmatic changes, is that we do not move forward with any major program or policy changes without stakeholder engagement. So I'm going to be talking about some ideas that we've floated, but I don't want people to be up in arms around thinking that we have already created outcomes or a process, maybe a little bit of a process, but not necessarily an outcome for some of these activities. We are really great about asking you all in the field. So these are our strategic planning goals, and again, it's about for about 2 to 4 years out. As you know, we operate on the biennium for a lot of the work we do, and we have a lot of planning, and then we have a lot of piloting, and then we have implementation. So we have identified working on updating the certification standards to reflect current best practices in the field. We want to align our key performance measure program and improve some of the strategies and align those with other systems and strategies that are happening. We also want to focus on providing our school-based health centers with more opportunities to learn from each other, from the clients or the students, and work to improve the policies and practices. So I'm going to dive into each of these a little bit more with some of the details. And again, these are things that we were brainstorming and talking about, but we will be engaging the field around these. So don't be surprised when you hear more about us asking questions. So the first one, which is updating the certification standards to reflect the current best practice in the adolescent healthcare. As you know, we have supported integration of mental health into the school-based health centers the last couple bienniums through the Mental Health Expansion Grant. Prior to the grant, the grant started in 2014, about 40% of our school-based health centers had a mental health provider on site, and now 100% of them do. The standards do not necessarily reflect what mental health integration may look like, especially at a 100% model that we're operating now. So we really want to figure out what does that mean to have mental health be a consistent partner at the table and in our school-based health centers. We are very fortunate to have Erin McCulley, who is a social work, master's in social work intern with us, and she is doing some research on the best practices for young people around mental health and behavioral health services. She works in state public health, so she has a very great foundation for public health work and public health knowledge. So some of her findings really focus on the effective model of integration. As I talked before, this is not a surprise to you all that the more fully integrated that a clinic is with your primary care and your mental health, the better outcomes there are for the clients and the students that you see. And what we're talking about is same-day availability, having brief interventions and long-term therapy, sharing your electronic medical records, and being able to do that care coordination and have that continuity of care in those warm handoffs. And that's what we're talking about at the highest level. Some of the research has defined at the lower levels where you have a behavioral health contract, or where you can have referrals made from the primary care provider to the behavioral health providers for long-term therapy or specialty behavioral health. And then somewhere in the middle, there's that where behavioral health services are co-located with the primary care. You might make referrals even within that co-location. You might either do brief interventions or long-term therapy, and brief interventions might go through a behaviorist model. And services may or may not be available same day. And then there may be some barriers associated with coordinating care, and especially if you have different EHRs, that could also create some barriers and challenges. I'm happy to say that I think almost all of our sites with 100% of mental health on site operate at least at that middle level. So I think we are moving along that continuum, and what we're really looking forward to is trying to support the sites to be able to move to a stronger integration model. Some of the other research that Erin has been able to find for us around the best practices are not going to be a surprise, I think, to the field, is that stigma is a barrier to students accessing mental and behavioral health. So we've talked about perhaps there's some ideas about where we might improve integration and communication with the school, the teachers, the school staff, between the school and the SBHC to break down some of that stigma. Obviously, marketing and working with the young people in your YACs are really important also. And the other one that I'm going to highlight today is the lack of culturally responsive behavioral health services as a barrier. So again, this is probably not a surprise, but the more culturally responsive a provider is, the more likely students will initiate and continue services. And so this could be about having translation services or being more knowledgeable about cultural beliefs and attitudes, and really having providers be knowledgeable about the impact of the historical and generational trauma and the systemic oppression that's happened. And so we're talking about, with that equity lens, around how to support the cultural responsiveness in being able to support the field. I think particularly when we're looking at the data that Sarah showed earlier around the obvious disparities among race, gender, sexual identity, being able to be somewhat responsive to that data and figuring out how that may look, particularly when students are accessing mental health. And then, let's see, the next one, so I'm only on bullet one, so now bullet two. The second one is to align the standards with existing best practice with respect to youth-centered care. So we really want to focus on the recognition and support to you all in your commitment to youth-centered care. As you all know, certification of a school-based health center is a voluntary process, so any site could be operating, but really going for certification, you obviously get that extra funding, but you have taken that step to also be more youth-centered. And so we really want to work on trying to recognize that and support the field around the youth-friendly environment, which we've done a little bit of work in the past. Some of that work involves looking at potential tools and models that have already been developed around adolescent healthcare, And we've partnered in the past with the Adolescent Health Initiative out of the University of Michigan to provide some trainings for the field. And part of that work now is really us maybe leaning into them for some support and looking at their models and their framing for us to push that out to our Oregon school-based health centers. I believe that you all are already doing the work, and part of that is for us to be able to reframe potentially the work that you're already doing and really highlight that youth-centeredness to it. And then the last piece is to make improvements to the school-based health center, the site visit process and the compliance practices. So we've had Karen and Rebecca around now for a while, and really looking at the nurses providing better support around that school integration work. As you all know who've experienced site visits with them, they try to go into the school and figure out what the school thinks about the school-based health center, and then asking you all at the school-based health center, how's your relationship with the school? And I think we're really going to be pushing for improving the integration with the school, and then figuring out what does that look like when the nurses are on site, and asking questions or really providing that support or advocating for you all with the school. The other pieces, they're working on aligning some of their site visit practices and figuring out how to create some user-friendly forms so you're ready for the site visit, and so they're both on the same page, and it's a fairly predictable and transparent process. Next slide. So the next goal is the Key Performance Measure program. So we've had the Key Performance Measures for a while, and we've been discussing and also recognize that we need to update it and perhaps even give it a little more life and meaning to the program. As you all know, we have expectations for you around the measures. We create benchmarks, we track, you have to fill out waivers for Loretta. And what the discussion really, I think, was focused on, well, how do we actually support the field to make this more meaningful and really support you in the quality improvement of your clinic activities? So some of the discussion has been around possibly retiring some of the current measures, bringing in new ones. Part of that also, as you know, in the past, we try to look at what is happening around other metrics that you have to track, potentially around the CCO metrics. We want to look at the trending adolescent health needs, and that could be around mental health, suicide prevention work, and possibly looking at an equity measure. So those are some of the initial discussions. The other potentially exciting piece that we were trying to figure out how to make it work and learning about is to create some sort of financial incentive program that would be tied to the key performance measure work. So we really want to recognize improvement. We know that clinics are very different. They have different medical sponsors, different clients, different populations they're working with. So for us, it's really about recognizing that you're doing the work and how do we financially incentivize some of that improvement work. So up here, the bullets are really about how the process works for those of you who haven't been part of it in the past. What we do is we do a lot of the homework. We research some of the measures that are out there. We are working on trying to figure out what are some incentive programs that other programs and agencies are working on. We will create a work group that will evaluate our options and develop the new recommendations. And then we gather all that input from the work group and we put recommendations out to the field. We allow the field to give feedback, and then we pilot test it. So currently our timeline is to have some pilot measures in place for the 21-22 service year. It's exciting to us. And the last piece is providing the school-based health centers with the opportunity to learn from each other and the youth they serve to improve your policies and your practices. We're very fortunate to have Tara Miller join the team as a systems development specialist. And hopefully we can, with Tara here, we're able to reflect on how to best support the field. That position, as you know, in the past was cut, so we definitely shifted a little bit away from the technical assistance we were able to do and had to focus on more of the compliance aspects of the program. And now with the position funded and a person in it, we would love to, as a program, shift back to more of that technical assistance and training and really supporting the field to advance. So you'll be seeing some of that work come out as we're shifting our attention back to that. So the technical assistance opportunities that we're thinking will probably align with some of the work and interest that comes out of the certification standards, some of the KPM discussion, but also this needs assessment that Tara will be putting into the field when she comes back. So what you will see is some sort of engagement with you all in the field around what your needs are and the best way for us to provide that technical assistance. There's many different ways to provide technical assistance and training, right? So there's webinars and there's group convening, learning collaboratives, regional ones, site level, county, and really we want to open it up and figure out what is going to be the most effective for you all in the field, knowing how busy you are too. So again, the other piece is you all might have maybe experienced a little bit of is trying to learn from the youth that you serve. So we've tried to, in our coordinators meeting, have youth panels. And obviously you have the satisfaction survey data that comes back to you, but really diving into more of getting that youth voice from specific communities that apply to you all, and then really getting that back to you so it's really meaningful. That's a lot of information, and so if you have any questions, feel free to type it into the box. Or I can get back to you also. There's a question. I'm trying to read. I'm sorry.
Are you revisiting the 70% for health assessments?
Okay, and there's more.
There is more.
Well, that's a great question, Alex. And yes, we are. Is the bottom line. We just had a meeting, I don't know, this week or last week to start planning for all this work. And we are definitely thinking about the health assessment. Great.
Okay.
And again, this is all just starting, and but you will be engaged. So please, we'll ask people to convene on stakeholder work groups, respond to surveys, and I hope you all will be as excited as we are. Great. So, next slide. So now I'm going to shift over. This is just a reminder that our adolescent and school health unit is comprised of, we have a policy and assessment specialist, the school-based health center program, school nursing, and youth sexual health. And I think it's really important for you all to also hear about the other work that is happening that is school health related, because you will be hearing about these things potentially in your community. And it's important to make sure that we are maintaining those connections and recognizing that some of those projects, programs, initiatives are coming out of the same office that the school-based health center program sits. So I'm going to turn it over.
We did have one more question about will the student survey results, I assume satisfaction survey results, be returned more frequently so we have data more than once per year?
We haven't talked about it, but we could talk about it. Okay, it's on Kavita's mind now. Thanks, Karen. We'll include that. Okay.
All right.
Turn over to Corinna.
Can we do a quick time check? Do we still want 10 minutes?
Yeah, you're good, I think.
All right. Hello, I am Corinna Brower. I'm the state school nurse consultant, and I'm going to talk briefly about some numbers. We have relatively limited data on school nurses compared to school-based health centers across the state, but I'll share what we have, and then some of the activities that we're doing to support school health and school nursing specifically across the state. So this first image, this is a graphic that for me is showing school health services and kind of the really broadly where they fall across the state. We're still working on 2019 map for school nurse ratios. Hopefully we can get that out soon, but for now I can say that the numbers look very similar. We have 12 districts that have services now that didn't when the last map was created, but overall we still see kind of the same service areas, which to me points to, when we talk about school health services and school-based health centers, school nurses specifically, that one does not replace the other, that we're not seeing areas where we don't have school nurses because we got a lot of school-based health centers, so we don't need them, or vice versa. So that's general ratios across the state. If you go to the next slide. In terms of numbers, a lot of where we see school nurse data publicly is ODE's annual report on school nurses, school nursing services in Oregon Public Schools. So we have around 580,000 students that are captured in that data, in ODE's data. Of those, schools report to ODE that about 28,000 students have medical needs that require nursing services in schools. And those little bullet points below that, just looking at the numbers, that's less than 5% of our students, which is surprising because both state and national data tells us that around 25% of youth under the age of 17 have some sort of chronic condition. And other state school nurse consultants in states where they track that type of data are saying around 17 to 20% of their students require nursing services. So even if not all 25% need nursing services, a good portion of them usually get it. And we're not seeing that in Oregon at the moment. Next slide. And part of that is concerning to me because some of those 28,000 students are in those districts that on that map don't have any access to nursing services. So I think, and I do not have cause and effect data, but I think that we're just not finding those students. We're not providing the services and we don't even know that they're there at this point. The good news is, as of 2019, we've seen a significant increase in the number of school nurses that are available. And even just this last month, I've heard from 3 different districts that are increasing their school nurses, in some cases doubling their school nurse task force. So there are some positive things happening. We're not quite there yet, but we remain hopeful that school health services are going to increase. We're existing in a state that is not perfect. It hasn't changed much in the last 5 to 10 years, looking back at the data historically. Our nurse to student ratio for Oregon is one of the highest student to nurse ratios in the nation. We tend to be down in the not in a great area in terms of being able to provide services. We have also there are those 4 districts that meet the recommended ratio of 1 to 750. That's double the number of last year. So we're still seeing improvements. There were only 2 last year. So not great in terms of nurses being able to do what they are trained and experienced to do in serving students, but we're seeing improvements. We're going to keep that as our mantra and hope that continues. Next slide. We know that Oregon's laws actually say that schools are required to provide those nursing services if they're needed. There are some questions. If we don't have providers in the area, how do we even identify those needs, much less provide the support? And how do we utilize that licensure to provide all the supports that they could provide? So above and beyond, getting that diabetic student their lunchtime insulin, we could be working with some of those broader school-wide efforts. We could be collaborating more closely with the SBHC in our area, those sorts of things. So we're hopeful if these trends continue, we'll be able to do more of those comprehensive supports. We also know that if you have, the front office kid shows up and it's the secretary that's doing an intake as opposed to a registered nurse, we're not likely to see the same level of care. If students are getting referred to the SBHC, sometimes we're seeing less accurate referrals. People are ending up going over that maybe should have been sent to another provider or vice versa. And if we have registered nurses in place, there's a greater chance that you're having higher quality care coordination between SBHC providers, school staff, families. So that is essentially a summary of the data we see on school nurses. about half of what I do as state school nurse consultant is providing technical assistance directly to those school nurses. They can call or email, and I'm providing whatever support I can. About the other half, so the next few slides that I'm going to share with you are, what are we doing about it? We know there's some challenges. How are we supporting school health and school nurses across the state? One of those partnership activities that one of the efforts that I'm participating on is a grant. There are 17 states nationally participating in this grant, that in Oregon, 6 of our districts are working to implement the WISC model, the whole school, whole child, the whole community. The grant itself focuses on 3 priority areas, so physical activity, physical education, nutrition, and chronic disease management, which is the school nurse portion. And this model, for anybody who's not familiar with the model, hopefully most people in the room are familiar with it. If you're not, it really emphasizes the fact that school health and student success are closely linked, and that it's not one person's job. It's not the job of the SBHC, it's not the job of the school nurse, it's the entire school community, families and surrounding communities, as well as everybody from, you know, your PE teachers, your nutrition staff, your classroom teachers. Everybody is part of the effort. So there's some intentional work going on around the state that I'm supporting on using that model and using the tools associated with that model. I'm also working very closely with the SBHC team here on the School Health Services Planning Grant, which is actively underway. We have 11 grantees, mostly districts, a couple of ESDs as well, who are assessing their school health services and their school health needs, which is phase 1 of the grant. And then in phase 2, we'll have the opportunity to potentially be funded for either school nurse or school-based health center model. And this, from my perspective, is a really exciting opportunity, because it means as the state, there's possible funding for school nurses, which means we have to figure out how to assess school nurse services in a different way than we've had to in the past. School-based health centers, I don't know that that's exciting for all of you that there are certification standards, but it's exciting for me to think that we might have some sort of key performance measures or benchmark goals for school nurses, and be able to develop some of those tools to help support school health and school nurses specifically in a way that's just not being tracked right now. And then another one of my partnerships, probably the thing I spend the most time on, is directly with ODE. We have a monthly day-long meeting with school nurses from across the state, talking about what's going on and providing some statewide guidance. I work pretty closely with the person who is working on Medicaid billing for school health services, so understanding what the potential is there. And then Student Success Act, you're about to hear considerably more about. Again, hopefully everybody in the room is familiar with that, but if you go to the next slide, there's just a general image of what you can see on ODE's page. And then the next slide, one of the things that we did collaboratively between that SNAG group at ODE and Oregon School Nurses Association, other members, creating a one-pager that links how school health services and school nursing specifically connects to the goals of the student investment account. And Sarah, at the beginning of this, talked about the student health survey. And I'm thinking, if we consider how student health services needs, student health needs data could inform SIA planning. There's opportunities for funding school nurses. There's opportunities for funding school-based health centers. So if we have that data, just another little push for encouraging you to engage with your school community on getting that survey implemented, if at all possible. That's the last of the information I'm sharing. I would love to hear comments, maybe just leave contact information if you want to. I'm curious what relationships exist or not in your area between your SBHC and your school nurse. Is there a school nurse that you engage with at all? Is there a strong relationship? Is there any sort of formal partnership? Do you meet at the beginning of the school year or anything? Is there absolutely no contact? I'm just curious what the relationships are, and if people could share some of that information, I'd really appreciate it. And if there's any questions for me, if there's anybody
So if people want to answer Corinna's question, you could type some thoughts about your relationship with school nursing in the chat box, and we can share that with Corinna after the webinar. Or you can send it.
All right.
We're going to shift over to Sheila now. Youth Sexual Health.
Hi, everybody. This is Sheila Johnson. I'm the Youth Sexual Health Coordinator for Adolescent and School Health. And I just have a few updates and things to share with all of you. It's always interesting to me to think about, you know, the three components that the CDC talks about for young people when it comes to sexual health would be sexual health services, which we can think about with school-based health centers and school nurses, but we can also think about school health education, sexual health education, and also safe and supportive environments. So you can kind of think of the Youth Sexual Health Program as handling some of those pieces when we think about adolescent health. So you may know that we have been receiving federal funding for pregnancy prevention. That's called the PrEP grant, Personal Responsibility Education Program. And we're making some pretty significant transitions with that funding coming up starting this summer. And so we're really moving away from funding local public health to do pregnancy prevention programming in schools to really supporting a population that has not been getting their needs met, and that's folks with intellectual and developmental disabilities. And so we're going to be funding OHSU, who has a statewide work with transition age young people 18 to 21 to do a program called Friendships and Dating, which is actually out of Alaska. And so this program, we're going to start training folks in the summer to start implementing in the fall. But it's a really significant shift for us to be working with a specific population and to really be doing work statewide with one partner at OHSU. And so for those of you, you can go to the next slide. For those of you interested in what some of this work could look like with folks with intellectual and developmental disabilities, Multnomah County Health Department, their Youth Sexual Health Equity Program has done such great work with folks with intellectual and developmental disabilities. And you can go, they have a guidelines for supporting the sexual health of young people. They have a whole document and website dedicated to that. And then also OHSU has their sexual health equity program too. So those are just some links for you as you, I am sure, are meeting the needs of folks with intellectual and developmental disabilities as well. The other thing I want to share with you is that we work really closely with Department of Education and also our partners at DHS. And we do quite a bit of teacher training and support. And we do a collaborative training that we call OTTI. We just had our first pilot of 2020 in Albany this week. And we have added a day's training for K-5 specific to gender and sex orientation. We'll be doing that training in March in Roseburg, in April in Astoria, and in July in Ontario. Part of the full day training, we have a community panel, and we have often asked school-based health center folks to be a part of that. If you are interested or know people who would be interested or want to be a part of this training or just know that it's happening, feel free to contact me. My contact information will be coming up. And you may know that the Injury and Violence Prevention Program within public health has really been looking at sex education as a primary prevention for sexual violence. And given the data that Sarah shared and also what we know about implementation of sex ed policy statewide, this map has been a tool for us to share. So Laura, if you can click on that map, I want to be sure that school-based health center partners know that this map exists because we're about to do the 2020 update. So, is it not linking?
No, they can see their view.
Sorry.
They can see it.
Okay, great, if you can see it. So what I want you to know is that there, if you were to go down past all of the data, there are local resources. So there are sexual health services and DVSA partners, and SBHCs should be linked on those local sites. And so if you have information that needs to be updated, or if you didn't know that this existed, I want you all to be aware that this is happening. It got quite a bit of media attention when we did a joint press release last year. We expect it to do the same this go around. So know that you are a part of this, this project. Also, just know that we're here for you. We know that pregnancy rates are down, and we know that STD rates are up, right? We know that sexual violence continues to be an issue, and we know that safe and supportive environments for our LGBT young people are few and far between. So just know that we have a team of 3 here in the Adolescent School Health Unit to help. You can contact me for just kind of general information or issues around sex education statewide or the map. LaShonda is here for you as for data requests or research support or evaluation. And Lindsay really coordinates our PrEP program and is working with our work around youth with intellectual and developmental disabilities, has a lot of great skills around curricula and adaptation. And we always love working with our school-based health center partners. So thanks, everybody.
Any questions for Sheila?
In response to.
Okay, it looks like some of you, thank you so much for typing in some of the school nursing partnership stuff. Okay, we're gonna shift over to our next partner presentation. Tamara, are you on? If you are, you can, we're looking for you, and you were there. You're not there anymore. You scroll to the top. Yeah. Okay, well, we'll see if Tamara gets back on. She was going to talk briefly about the Student Success Act. Maybe we can shift over to Ashley. Yep, Ashley at the Oregon School-Based Health Alliance. I hope you're flexible and there, Ashley. Yep, she's ready.
Okay.
Ashley, you there?
Yes, I am. Can you all hear me?
Yes, and thank you for jumping in.
Oh, of course. Yeah, so my name's Ashley McAllister. I'm the program manager at the Oregon School-Based Health Alliance, also known as OSBHA. And I'm speaking on behalf of our team today. So next slide. This is our team. I'll provide contact info on the last slide if you want to follow up with any of us. And as most of you know, OSBHA is a nonprofit org that works closely with the state program office, and our mission is to strengthen school-based health services and systems that promote the health and academic success of young people. Today I'm going to share about an event that we have coming up and then one of our new programs. Next slide. So School Health Advocacy Day is happening this month. It's always like the most fun that we have all year. SBHCs and YACs from across the state will be at the Capitol on Tuesday, February 25th for what's this youth-driven advocacy event. It supports school-based health services in Oregon. And this year is shaping up to be a really good event. I think registration has officially closed, but we'll still let you come if you want. So I'll give a little more info. In addition to the opportunity for youth to meet with their legislators and advocate for SBHCs and other school health services, this year we'll have youth-led workshops, a panel highlighting careers in advocacy, spoken word and meditation led by youth, and Governor Kate Brown will be kicking us off in the morning. So we're excited to have her there at the event with us. This year we're also providing a poster template, which you can see on the right side of the screen. And this is like something that you can customize to make, you can customize this to share info about your SBHC with your legislators. So it includes some statewide data from SPO, and then also there's a few spots for you to add photos and data specific to your SBHC or SBHCs. So like I said, if you're not already signed up and you still want to come and bring youth to this event, just email Jessica Chambers, our admin coordinator. Her email's at the bottom of the screen, and she will get you the info that you need to join us on the 25th. And next slide. we also have a new program called YAC Coaching, which we've been developing through our contract with SBO. YAC Coaching is designed to support school-based health centers in assisting and developing sustainable youth action councils, youth advisory councils, student health advisory councils, whatever you call them. We call them YACs. And we believe that this work will lead to improved health outcomes for youth and improved school-based health center services. So our YAC coaching team includes OSBHA staff and student health advocates. The student health advocates on this team are part of our Youth Adult Partnership Committee, which is a new student health advocate committee that's formed this year. And our YAC coaching team, our adult and youth team, we're working with the Hood River and Ione SBHCs for the 2019-2020 school year. And so we're providing on-site and remote support to these school-based health centers and going out for our first site visits in a couple weeks, which we're really looking forward to. So our current focus with YAC coaching includes recruitment and retention for the YAC, supporting skill building for both youth and adults, and equity and inclusion. So we're really excited to be developing this work, and we know there's a lot of interest in it. And our organization hopes to continue to expand on our ability to support YACs. We're working to develop some resources that will be shared with other SBHCs across the state. So we do have a YAC recruitment tips document that we just created with input from YACs across the state. So if you're interested in seeing that resource, email me and I'll send it to you, and we'll also be sending it out later. But yeah, this has been a really exciting program, and yeah, like I said, there was a lot of interest in it when we initially spoke with a lot of you at the in-person coordinators meeting in the fall, and so we're eager to continue to explore how we can support YACs across the state, because we really think that they're a really important component of an effective SBHC. So next slide is just some info on how you can get in touch with our staff, a link to sign up for our newsletter. And that's if you don't already receive the newsletter, I think most of the coordinators receive it, but I'm not sure about mental health staff. And it's a really good way to keep up to date with our events and programs and policy work. And then we're also on social media. So please follow us there as well. And then I just wanted to, open it up and see if anyone has any questions.
Ashley, this is Roslyn. Is the recruitment tips resource something that we could help you send out to all the coordinators or our listserv if you want to share it? Okay, great. So if you send it to us, we can send it out.
So we do have one question, Ashley. I'll read this question. Can a school have more than one YAC? We'd like to form several to grow more opportunities for youth to have expanded community service learning projects around health and well-being for the community.
So, I mean, I actually haven't heard of a school having more than one YAC, but I do think there are YACs where there may be like committees that are formed within the YAC. So you could have a YAC with students working on several different project areas. And that's, and I'd be also happy to talk, whoever was that asked that question, feel free to email me, and I'm happy to also help you think through the formation of that.
And we can connect you with that person also, Ashley.
Great, okay.
Any other questions?
No other questions.
Okay, so now we have Tamara back on. And so Tamara, we're gonna unmute you. Can you hear me? Or
it says just self-muted.
Oh.
Tamara, it says that you're muted on your end. I can't unmute you.
I'll give you a minute. There is a handout that Tamara has shared with everyone. So if you go to in your panel, your control panel on the right, there should be a handout section, and there is a handout, and it's called, I think it's called Student Success Act Resources or Investment Resources. We're going to try. We're going to wait one more minute to see.
I can't. Okay, now.
Okay,
now.
there you go. Are you there?
Try one more time, Tamara.
We don't hear you. Can you hear us? It says you're unmuted on our end. I'm gonna give her one more minute. I appreciate everyone's patience. Well, as we're working through this, I do want to give an update for our next coordinators webinar, which will be on May 6th. Which will be on May 6th, 9 to 11. So that's our spring coordinators webinar. We will send out a save the date in the next couple months, so you'll see that, and then we will send out a follow-up registration. And Tamara, do you want to try one more time? Okay. Well, let's pull up this handout real quick. And can you pull up the handout? So I hope everyone can access this handout. It's a handout that Tamara has shared with us with the field. Let's see. So it talks about the program funding for 1921, and many of you have already heard about the Student Success Act at our coordinators meeting. Hopefully that you have been at least somewhat engaged with some of the community input gathering around the student investment account progress, and hopefully you've been at the table with some of these discussions, because it really is about focusing on student health. So this handout is a great breakdown of some of the information, and Tamara is the Student Success Act coordinator for the Department of Education. If you have specific questions around the Student Success Act, she is a great resource, and we will share her contact information as part of the slides when we get those out. I'm going to see one last time. It looks like we're having some technical issues, and I don't think we're going to be able to get Tamara on today, which I apologize for, both to Tamara and the field. But the resource is a great one, and again, we'll get her contact information out. Any other questions? This is our contact information. How's our program email? What? The program email, are we having any problems?
No.
Okay. We were having some problems with our school-based health center program email for a while in the last couple of weeks, where it wasn't accepting some emails, but if you were having a problem, you should have received a bounce back that says that it didn't go through. Hopefully none of you, if you haven't heard from us and you sent us something in the last week, please resend it. Otherwise, it should be fixed now, and that should not be a problem. So thank you all. And again, I apologize to Tamara that it didn't work for the Student Success Act, but hopefully everyone's able to download that resource. And if you have any other questions, feel free to follow up with us offline. Thanks, everyone.
Thanks, you all.
Thanks, everybody.